provide you with insights on breast cancer and mental health awareness over the next 1 hour. While we wait for other attendees to join, I'd like to give you a brief background about the series. Leading Conversations with FBN Quest is a webinar series created to bring you market, industry, and consumer insights and analysis that are crucial for individuals and corporate success. The series features the leading professionals at FBN Quest, as well as other industry experts with expertise in corporate and private investment management, wealth preservation, financial advisory, and all other areas of interest. We hope to open your minds to a world of opportunity through these sessions, and we very much look forward to engaging with you. This session, like I said, will run for an hour, and our speakers are the very informed Dr. Oluwakemi Akintoyeshe and Dr. Dorcas Ntiamoth. Welcome, speakers. We're very pleased to have you here. I'd want to give a quick introduction of the two speakers so we know the powerhouses that we're dealing with today. Dr. Oluwakemi is a clinical psychologist who is passionate about self-development training and individual wellness. She believes that the understanding of the holistic man can bring about the desired transformation in the family, workplace, society, and the world at large. A healthy individual, in her words, is a healthy society. She is the founder of Help From Above Initiative, a platform that provides help for sexually abused. And she is the head psychologist at Grace Insight Limited. Our second speaker, Dr. Dorcas Ntiamoth, holds a Master's of Philosophy in Clinical Health Psychology, and she's a certified cognitive behavioral therapist. She has several years of experience in performing clinical interviews, psychological assessments and testing, diagnosis of psychological conditions, as well as providing physiotherapy. She has presented a number of scientific papers, both locally and internationally. Dorcas is committed to addressing the variety of psychological, behavioral, emotional, and social issues that arise for patients and their loved ones during treatment. Now, moving on to today's program. I'd start by mentioning that please, we should all note that there would be a question and answer session towards the end of the program. So please send your questions via the chat room, which would be available right through the session so that we can attend to them appropriately. So moving on to the questions, I think I'll begin with you, Dr. Dorcas Ntiamoth. Welcome.
Thank you for having me.
So my first question is, let's start with the basics. And I see from your t-shirt that you're ready for me today.
Yeah.
What is breast cancer and what causes breast cancer?
Okay, so first of all, when we talk about cancer, cancer simply means cells that are outgrowing its numbers. When we say cells, cells is the basic unit of life. Cells is what makes us individuals. So when we are talking about growth of cells that are leaving its numbers, they are growing abnormally. That's what it means by cancer, cells that are growing abnormally. However, depending on which parts of the body the cells decide to grow, that is what we would add the part of the body to it, and then we'll add cancer to it. So when we are talking about breast cancer, we are talking about cells are growing abnormally in the breasts. So we can have head and neck cancer, we can have prostate cancer, we can have sarcoma, we can have tissue cancer. We have a lot, depending, even in our cervix, we have cervical cancer. So depending on which part of the body that these cells are grow abnormally, that is what we would term as cancer. What causes it? Currently, there is no research that shows that you eat this, you do this, and it brings cancer. No, there is no known research that validates a particular thing being the cause of cancer. However, research has indicated so many risk factors. So the first risk factor I will talk about is the fact that you are a woman, you have breasts that are bigger. it puts you or it predisposes you to the risk of developing breast cancer as compared to a male. And the fact that you are a woman and you haven't given birth, you don't have a child, it also puts you at a higher risk of developing cancer, because we have these hormones in us, estrogen, and this estrogen are produced in excess whenever we are menstruating and whenever we are even giving birth. When you're lactating, children takes the breast milk and all that. So whenever a woman is pregnant, you should know that ideally God has made it in a way that when you are pregnant, you don't menstruate. Most women don't menstruate. When you're breastfeeding, menses stop. So this is also done in a way so that it put the body at rest from the hormones that are being produced almost every month. So if a woman does not get this chance, or due to infertility or other issues, the woman decides, oh, there is no baby, it put this woman at a higher risk of developing breast cancer. Now, I'll talk about family history. When there is a history of cancer, any type of cancer in your family, meaning it also puts you at a higher risk of developing cancer or breast cancer. So if you have a relative who has been diagnosed of prostate, cervical, we are talking about sarcoma, soft tissue, any type of cancer, it also puts you at a risk of developing cancer. Genetically, we have these genes that we call BRCA1, BRCA2. These genes predisposes you. So we even do blood tests. You can even do a blood test to check your tumor markers. Those are the markers we use to check when you are doing treatment, to check if the cells are coming down or it's outgrowing its number. So for the fact that it is in your family, it also puts you at a risk. Now, the fourth thing that a lot of people haven't taken notice of or we overlook is prolonged use of hormonal treatments. I'm talking about contraceptives. I'm talking about hormonal treatment, treating fertility, and you are being given all sorts of treatment, medication, also put you at higher risk of developing breast cancer, because already naturally when estrogens are produced in excess, it puts you at risk. And now you want to, delay birth. You don't want children as such now. And every time we are taking in injection, we are taking in pills and all that. And research has indicated that prolonged use of this emergency contraceptive, one image, I won't mention the name because of ethical, it shows that prolonged use of that particular emergency and contraceptives puts females, especially the younger ones, of having breast cancer in later ages. And then the last thing I would want to talk about is unhealthy lifestyle. I'm talking about not eating well. I'm talking about not having regular exercises, not checking your weight. The fact that you are overweight, you are obese, also puts you at the risk of developing breast cancer. Drinking, alcohol intake, excessive intake of alcohol also puts you at risk of developing breast cancer. And also smoking, it also puts you at a risk of developing breast cancer. So these are some of the causes I would want to outline for us to know.
Thank you so much, Dr. Dorcas. I love the way you went back to the basics of the cells and all of that. This is very informative and I'm learning quite a lot. You mentioned women being at higher risk, which sort of suggests that men can have breast cancer. So please clarify, can men get breast cancer?
Yes, please. Research has indicated that 2% of men stand at risk of developing breast cancer. What it means is if I'm to do a random counting, 1, 2, 3, the probability that the 99% and the 100% will develop breast cancer is high. Personally, I've seen one before at my facility. Yes. So far as there is breast, you have these breast tissues there. You know, some men have a lot of breast tissue because of muscles and all that. It put them at the risk of developing breast cancer. So they are not totally out of the picture. They also stand a chance of developing breast cancer. Just that compare to women are at a higher risk of having breast cancer.
Thank you so much for clarifying. If I had known this, I would have invited a few more men to today's session, but now I know. Okay, so my next question is around the signs and symptoms of breast cancer. What does it feel like? Does it hurt?
Okay, so to come to that, now talking about the signs and symptoms, first, whenever I'm doing presentation, I talk about the fact that one needs to be really aware of your breasts. Ideally, one breast is a bit bigger or denser, heavier than the other if you really know your breast. And we have a normal lump in the breast, like this big, that takes a bigger portion of the breast. Some people don't have, but majority of women have. So when you are really aware of your breast, you know the size of your breast, you know the color of your breast, you know your nipples, are they inverted, are they outward? Like when you are really aware, it helps you to know the changes that come so that you quickly look for help. The first change I will talk about is color change. When you know, ideally, my breast is darker or fairer, and then all of a sudden I'm seeing a patch which is so reddish, which is so darker than the normal one, then you should know that there is a problem. You need to start looking for help. Now, there is a lump. This lump is very movable. Most of the time, it's a painless lump. At most, about 90% of women will tell you it doesn't hurt from the beginning. When you meet survivors and you meet people who are being on treatment, they'll tell you it doesn't hurt. You just feel a very small lump. And then within some few months of this, you can feel that it's growing. It's not the same thing. And it's normally most breast lumps start from the armpits, this side. So you feel those, yes, they migrate from there and then they come to the breast itself. So when you notice a different lump from your normal lump that you know, then it is a sign that you need to go for further investigation. Again, we call something dimpling. If you all know oranges, when you buy a bigger orange, you see that there is this like small hole in it. That is what we mean by the dimpling. When you buy an orange which is a big, you feel that it's there. When the moment you see something around your breast or around the nipple, you should bring it to the hospital for further investigation. And also, when you check the breast, at times you squeeze the breast to see whether there is a fluid in it. If you haven't done this before, it is very necessary. When you are not breastfeeding, you are not having any, you don't have a child at the moment, then ideally there's not supposed to be any fluid in the breast. If there is a fluid, this fluid should be colorless, or it should be milky, or it should be the color of a milk. In Ghana, we a milk by Ideal Milk. I don't know whether it's the same at Nigeria, but I don't. If any of these colors are different, it's a bit yellowish, brownish, reddish, please, you need to come or go to the hospital for further investigation. That is when you squeeze the nipples and this fluid are coming out. These are some of the signs that will tell you that you need to come to the hospital.
Well, thank you. Those are very clear, and I'm sure, a lot of us are taking notes on things that we should do. Talking about searching and screening, should one ideally start to screen for breast cancer?
Okay, so ideally, from your teen age, you need to start screening. And the screening, we have different types. We have self-examination. Today, I'll take the opportunity to teach you how the self-examination, and that's your first point of screening. When you are aware and you know how to do this, you can easily detect if there is a problem. Then you come for further treatment. That's when you come for the clinical examination, where you will come and a nurse or a doctor will let you lie down and do it for you. At times you even tell, oh, I realize there is a lump here. I realize can you pay attention to this side? So you kind of direct even in the process of doing the clinical examination for you. So in your teenage, from the teenage, it is advisable you begin to practice the self-examination. Now, it's being educated, or in education, we tell you when you are in your teens, at least in the first 3 years, you should come to the hospital once so that you have a clinical examination of the breast. But if you are 40 and above, that's why we are having this October, Pink October. We preach, we do screening all about breast cancer. It's advisable that you use that opportunity to visit a facility or visit a screening point to get your breast screened by a professional. So ideally, when you are 40 years and above, every year you need to have a clinical examination of your breast, 40 years and above. But below that, you'll be doing the self-examination. And when you go to the hospital, you also take the opportunity and get the screening done.
Thank you so much. So I know that when I go for my checkups, that I'm often asked if I've done a mammogram. So I'd like you to clarify, what is a mammogram? Do I need one? And how often should I have?
Okay, so when we talk about mammogram, normally mammogram is like an X-ray of the breasts. So this is a picture. It gives you the nerves in the breast, the vessel, the lobus. It gives a clear picture of whatever that is happening in the breast. It helps to detect breast cancer at its earliest stage. But it is not where you will wake up that I'm going to do mammogram. When you come to the hospital and they do the clinical examination for you, normally the first point of contact, do a breast scan, which is a normal scan. So based on the scan report, the doctor will say, oh, I think there's a suspicion somewhere. So do a further one, which is the mammogram, which will give a clearer picture, and it will be able to note if this is cancer, because we are talking about lumps. Let me add this to you. Not all lumps are cancerous. We have benign lumps and we have malignant lumps. So the fact that you've detected the lump doesn't mean that automatically it's a cancerous lump. Most of them will go and then it turns out that it's benign. It's not cancerous. It can easily be taken out and you are good to go. So the mammogram gives us the impression that this is a cancerous lump or this is not. Even with that, after that, so that gives a
Hello, Dr.
final.
Dorcas.
Yes, can you hear me?
Yes, now I can.
Okay. So the biopsy gives the final verdict for the diagnosis of breast cancer. So with that, they will take the tissue of the lump, a part of it, so a needle will be inserted in where they will take a tissue of the lump, send it to the lab or to the standard board, Ghana here we call it standard board, and that will give you the final verdict that this is a cancer, and that one will give you the stage and the state of it for us to know precisely where it is. So that is my explanation to the mammogram.
Thank you so much. That's very
And
clear.
how often do you need it?
Yes.
Yes. Normally people above the ages of 40, ideally we say once a year, above 40, but it always has to be that prescribed for you or asked for. Don't go to the x-ray or the mammogram center that I'm going to take mammogram of my breast. No, when you want it done or your normal checkup routine, you can tell your doctor, please, I would want this to be done for me. You know, it emits x-rays, it's rays, and that one to radiation has its own effect on the body. So we don't, it's not an open place anybody can go that I want to do this.
Okay, I get that totally. Thank you. So my last question on this topic would be how everyone here who's listening now, I'm sure they're wondering how can they protect themselves from this? So how can we protect ourselves from breast cancer?
So first of all, as answering this question, since I said we don't have a known cause. How can I help myself to stay? So the first thing I would want to talk about is being aware of yourself. It can't be taken out of this. because we are all at risk, because we are women. We have breasts. So the first thing I can do to help myself is become aware of myself, because we keep preaching early detection saves life. So the moment I'm able to be aware that there is a change, there is a this, I can easily look for help. And then at the end of the day, at times it doesn't even graduate to the cancer cells we are talking about. So first thing I would want to talk about is being aware of yourself as a woman and taking keen interest in your breast health. The second thing I would want to talk about is maintain a healthy weight. Yes, we should always try that we should have a normal weight so that we don't go the overweight, the obese, because research say that this puts you at a risk of developing breast cancer. So as much as you can, try to stay within the range that will help you and all that. And then we need to be physically active. We need to be physically active. I'm talking about exercise, where you take keen interest in your physical health. If it is jogging, if it is walking, it is in any aspect that you do. And exercise too starts in the mind. You can walk a huge distance. If in your mind you are not doing exercise, you won't get the benefits of the exercise. So it should be noted that we should engage in physical exercise. And then the next thing I would want to talk about is eating healthy diets. We are talking about eating a lot of fruit, vegetables, protein, carbohydrates, and let's in their right proportion. It also helps you to what, stay intact, and then you decrease your risk of developing cancer, breast cancer. And then smoking. Excessive smoking. You know, we have active smokers and we have passive smokers. You might not be the one smoking, but your environment will predispose you to developing breast cancer. And then breastfeeding, as mothers. Now, because of work, we want to do lactogen, NAN, and all that. No, exclusive breastfeeding also reduces your risk of getting breast cancer. So the 6 months breastfeeding, please, if you are listening to me and you're a woman and you have a baby, please do it so confidently. 2 years, do it. It helps you so that you don't stand at the risk of developing breast cancer, especially when there are traces in your family or cancer traces in the family. So these are some of the things I would want to outline for us to
That's been
help us.
that's been very interesting. I always linked smoking with lung cancer, not breast. I'm really learning a lot. Thank you so much, Dr. Dorcas. And I'll circle back to you in the question and answer session. So for now, thank you so much. I just move on to Dr. Akinto Ishi for a moment. Welcome again, and thank you for being with us. So I'll jump in real quickly because we just have an we're talking to you about mental health. So let's start with understanding what it is. What is mental health?
All right. Good afternoon, everyone. Thank you for having me here. Thank you, Dr. Dorcas. That was enlightening. Even for me, a lot of things that we don't take note of. And one of them, again, is this issue of mental health. Because in our environment, the moment you hear mental, everybody start running away. We think low, we think a lot of name that people give to it. But mental has to do with the state of mental well-being. How were you able to function? It's more about how you think, how you feel, and how you behave. There is a link between our thoughts and how it now translates into the feeling, and then invariably translates into how you behave and interact with other people. Again, it's important to state that when we are talking about mental, we are talking about mental health. We're talking again about the fact that it's on a continuum. So please, it's important that we understand that, yes, even that person that you think it's mad or is out there crazy or something, it's still on a different continuum because it's still functioning. And the fact that somebody is functioning does not also mean that they are mentally okay. And so these are things that checks and balances that we must look at. And so mental health, according to the World Health Organization, is a state of mental well-being that enables a person now to cope with normal stresses of life. Do you have the ability to be able to go on and deal with life? Are you able to function, carry on with day-to-day activities? You're able to pick up life, and then you're able to deal with stresses. And then again, it's about realizing your potential. Who am I? How can I function? Do I realize my potential in the midst of this world? Am I able to bring on my ability to what I am doing? Or I see myself as less than who I am? Again, it's also about being able to learn and work well. Do I have the intellectual ability to be able to learn, organize things, take decision, problem solving, and quite a whole lot of things? And again, it's also about making meaningful contributions to the environment. And so when we are talking about mental, it has to do with I call it the state of government of the body, because without it, we can't function. Without it, we can't move. We can't do every other thing about. So it encapsulates the total function of who we are. When we talk about our emotional, we talk about our psychological, and we talk about our social well-being. Thank you.
Wow, that's broader than I thought. I didn't realize that not coping with stress was a symptom of mental health. So I think a lot of us have to really check in on such things. Are there misconceptions that some people have about mental health? If you've come across any, please share.
Oh, let me share the first one I came across when I started working in the mental health circle. And, we're passing through the Federal Neuropsychiatric Hospital, the popular Yaba left. And a woman said, I can't look. And I was wondering, why can't you look? And I said, no, I don't want to look at that side. And I said, what is on that side? He said, no, it's Yaba left. And I said, what is it? Now for her, even mere looking at that side, I don't know, it brings on her a kind of fear that she was like, I don't even want to see it. And a lot of people are so traumatized with even hearing the name. Again, people may forget, if you don't take care of your mental health, it's only when you don't take care of your mental health that you have a mental health condition. But that's not also true. A lot of people are trying. But please understand, the times that we are in, it's jeopardizing a lot of people's mental health. It's dealing with a lot of people cannot cope. Sometimes people will say there is nothing you can do to protect people from developing mental illness. Yes, there is something we can do. Yes, people would also sometimes say, oh, when you have mental health issues, then that is it forever. No, there are helps, there are treatments, there are lots of opportunities. And that's why we tend to stigmatize people about mental health issues and other things like that. Sometimes people would say, oh, having a mental health condition is a sign of weakness. No, it's not a sign of weakness. It doesn't mean that individual hasn't struggled or is not thriving or doesn't have the ability to be able to bounce back and deal with life. A lot of factors come into place when we are talking about mental health. So it's not a sign of weakness at all. It has nothing to do with strength or willpower or what have you. Again, sometimes people will say, oh, when people have mental health condition, it simply means that they have low intelligence. No, it doesn't have nothing to do with low intelligence. It just simply means that the individual does not have the reservoir or the capacity to be able to cope well with life at the moment. Sometimes it's because life defenses or the individual's defenses are low and they can't deal with life. And that's why they're having the mental health condition that they are going through at that point in time.
Thank you very much for clarifying these things. And I guess when you don't know, you don't know, which is why, it's important to have these sessions. So I want to bring this home to, the environment a lot of us are in. Can you share some statistics on mental health in the workplace here in Nigeria?
In the past, before the year 2020, they would talk about 1 in 4 person having a mental health episode. So that means, Dorcas was saying earlier, now this is even more shorter than the 1 in 100 that she was talking about. When you have 4 people in a room, 1 person would have a mental health condition. And don't forget that when we're talking about mental condition, it doesn't mean that the individual has a total breakdown, like we refer to as madness. It just means you're going through one form of mental health issue or the other. Common stress, learning disability, a lot of them, burnout, fatigue, all of these things are tagged to be associated with mental health condition. So, and the workplace is also becoming a fast-paced environment. It's demanding a lot. Now with the jackpot thing and other things like that, there's so much demand on individuals. Now, please don't also forget that this individual who everybody has jackpot in the work organization, so the workload is increased, the family responsibility is also increased and other things like that. And so increasingly about 64% of Nigeria employees are said to be at risk of developing one form of mental health condition or the other, one form of mental health condition or the other, which is quite alarming because it's high.
Wow, this is a bit worrisome, but luckily we have, specialists like you to walk us through this situation. It's best to know what the situation is and deal with it, I believe. So now that we're talking about the workplace, can you tell me what factors that affect an employee's performance could be a likely cause of mental health so that we can all look out for these things?
Okay, so there are various risk factors, and I want to say it maybe again, depending on the organization, depending on the workplace, but one of the most common one is discrimination. A lot of times when individuals are discriminated against, I once had an opportunity of attending to a company where people call in and sometimes because I am this, because I am that, they feel discriminated against, and that also now affects their functioning a lot of time. Again, sometimes when job roles are not well defined, people just come into job, do this, do that, do all of these things. You think, yes, they are multitasking and they are doing well. But again, it's not it, because it affects how well they are able to go on and carry on with their job. Sometimes to long hours. Now we think it's okay. Now people go to work by 7 a.m., they report, and then by 9 they're still there. It affects the brain. The brain isn't shutting down. The brain isn't relaxing. And so it's one task or the other. So the long hour oftentimes have very significant effect on the brain's functioning. And don't forget, coupled with the long hours, a lot of people don't have time to break. So they eat on the job. They eat junks and other things like that, and they don't even take break. And then so the long hour too also has a very, very tight effect. Sometimes even flexible hours. So some people are sleeping and then the mail come in, they jump up because they must attend to the mail at odd hours. And then they just want to get it done and then get it over with. That also affects their own violence, harassment, and bullying. There are also things that happen in the workplace. No, we can talk about it in different ways, but this is the reality of the workplace. Sometimes people are bullied in the workplace. People face harassment. You may not be able to talk about it. You keep quiet about it, but these are things that affect people in the workplace. Again, sometimes too, you have organizational culture that enables negative behavior. People lackadaisical attitude, nonchalant behaviors. One of the things that make a lot of people to have mental issues is when they feel they don't have control over what is happening to them. It takes them down. It takes them really down. I don't know what I am doing. Again, not finding fulfillment. When you don't find fulfillment in what you're doing, yes, you're there, you get the pay, but you don't enjoy what it is that you're doing. And a lot of things. So again, now, job insecurity, what will happen tomorrow? So you just hear some people are being sacked. Today, people are being sacked. Tomorrow, what happens? What's the future of work? What is going to happen to me? And so the threat is there. And that also brings a lot of worry, anxiety to people. And that also now affects them. When people are not allowed to go on breaks, casual leave or leave, you are not allowed to take it, all of that. Again, conflicting home and work life. Now, when there is no work balance, when the work, carry work to the home to the work, and a whole lot of other things, it tends to affect how well an individual will be able to function, and it could serve as risk factors to people having mental health issues. Thank you.
I think a lot of the time you were speaking to a lot of us in this session. So we're taking notes and realizing that, some things could be detrimental. So while I talk about realizing this, can you guide us? What are typical signs of mental distress?
Okay, so for a lot of people, depending on what we are talking about, whether it's burnout or whether it's fatigue or whether it's anxiety issues or depression, but one of the common symptoms that you would find is low mood. No, a change in mood. So this person is this hyper individual who comes in happy, ready to go on with the job, and all of a sudden just feels cool. And the low mood comes, you're not even able to explain yourself what is really happening. You can't give a clarity to why am I feeling this way. So it's like sometimes when people talk about it and say, it's like I woke up on the wrong side of the bed. No, you ask, is there a wrong or right side? But emotionally, they feel down. They just can't explain exactly what it is that is going on with them. Again, for some people associated with the low mood, now they have withdrawal. So they withdraw from activities, they withdraw from friends, they withdraw from things that they love to do. Again, it comes with loss of interest in pleasurable activities. So for some people, they are Barca fan, Man U fan, all of a sudden they can't even do it. The things that used to bring joy is not. So for some people now, depending, like I said earlier, depending on what we are treating, if it is anxiety, then the individual is not able to sleep. Now, if it is depression or burnout, the individual sleeps too much. Okay, so they are there, they can't sleep. And then associated with the sleep is the fact that even when they now wake up, they wake up still tired. They wake up, it's like they have not slept. So there's joint pain. As for some people, they lack motivation. The internal drive to get on and go on is not there. Again, there is also sometimes change in appetite. So for some people, for anxiety provoking situation, you find out that they tend to eat too much. But when somebody is depressed, burnout, or other things like that, then you are not able to eat. For some people now, it comes with inability to be able to solve problem. No, you can't concentrate. Now, this individual picks the phone, I want to call the HM, and then he just asks, I said, excuse me, who did I say I want to call now? There's information overload. So there is loss of thought, sometimes lack of concentration. So sometimes it comes with a lot of things. But when it starts getting worse, you now start having issues with some form of what we call psychotic symptoms. But before it gets there, people would most likely have noticed the odd and unusual behavior. So for some people now, they start believing that some people are after them, and then they want to get at them. For some people, they start believing that, some people are talking about them, they've ganged up against them, or hear voices, things that no other person is hearing, or see things that no other person is seeing. These are some of the signs that you can see.
These are very interesting signs, and I think they are signs that we see every day, and so it's very important, for us to look at them seriously. I mean, sleep deprivation, loss in appetite, lack of focus or able to solve problems. Sometimes just think, I'm tired, and we take it for granted. But I like the fact that you're pointing out that, look, these are starting signs, these are the warning signs. And, we should start to speak to a specialist before it gets to an extreme level. So I really appreciate that. So I just want to take a moment to mention that we would soon be going into the question and answer session. So please, all of us with questions, please put them in the question and answer chat so that I'll be able to get to them soon. Okay, so back to my questions, Dr. Akintoye. So what would you say is a mindful workplace? Because, when you were speaking about all of these things, I was like, is there any workplace that doesn't trigger stress from everything you said today? So what is a mindful workplace? And what practical steps can I take to prevent, these mental health problems?
All right, thank you so much, Anne. A mindful workplace is a place of work that values mental wellness and also foster a culture where employees' emotional, psychological, and cognitive needs are acknowledged and met. So it simply means that you take into cognizance the emotional needs of every individual. We're able to create a culture that inculcates everybody's emotional needs. So we are not just after the paycheck. We are not after the remuneration that they get at the end of the day, but we are also after their functioning. And then we curate an atmosphere where they can talk about their feelings. No, it's important. Sometimes one of the greatest things that happens to people is bottling up your emotion. You can't talk about it. You can't even acknowledge it. And that's why sometimes you will see people get very angry. Somebody that has been calm, cool, and collected, somebody that is easygoing, all of a sudden just burst out in the workplace. And then you start wondering, what's going on? Why? the person had bottled up so much, hasn't been able to talk. So when employees are mentally healthy, they are likely to be more productive, engaged, and creative. So it's an environment that values mental wellness. You foster culture where the needs are met, and then people are able to function as well as possible. So importantly, if we will be able to do all of those things, we must talk about our feeling. Curate an atmosphere where people are able to express themselves. Now, expression is not just about talking, shouting, but expression is about talking and being heard. Sometimes people talk and they are not heard. Now it's about talking and being heard. Now, when people talk, they express their feelings, they express their concerns, they express their fears and worries, or sometimes it's even about the workload. They are heard. And that way they feel cherished, they feel valued, they feel important, and that strengthens their emotional strength. Again, it's about also, like we say, staying active. Being active is one good thing that helps our body and our mind. It's not just about physical exercise alone. When we exercise our body, the endorphins hormone are released, and the endorphins hormones are feel-good hormone that helps us to be able to function and do very well. Again, it's also about getting good night's sleep. See, when you don't sleep well, then your body, your mind doesn't get the rest that it deserves. And don't forget that it's the mind that does a lot of things for us. So when the mind isn't rested, then the body can't move as it should. So it's important that averagely about 7 to 9 hours, or 6 to 9, if at least we are able to achieve sleep. Take time off. Take a break, walk away. Sometimes the work, they finish. It won't finish, okay? Take a break, walk away from it, shut down. And when you do that, you are your brain rests, and then you're able to, you feel recharged, like you are refueled, and then you're better able to function. Then balanced diet is also very important. Eat well. Now, I know that sometimes the demand of the job doesn't allow us to settle down and want to eat. But see, organize yourself. Vegetables, doctors talked about it earlier, and other things like that should be incorporated into the meal. Then again, it's also important that we practice mindfulness. See, being mindful helps us to stay in the here and now. Don't think about December problem. December would come and it will go. But let us stay here. Let us deal with the emotional situation that is now. What do I need to do now? How can I function? How can I cope? How can I deal with life now? Do it here and now. Forget the future. The future will take care of it. Most times we borrow the future's problem and then we add it up to today. We have not even been able to solve today's problem, but we add up the future to it. And that creates an overwhelming sense of pressure upon us. So we need that to practice mindfulness. Again, it's also important. Take break. Go out into nature. Just relax. Find an hobby aside the job. What else can you do for fun? Occasionally organize hangouts. Just come, shout, make merry. It doesn't have to make sense, but just be there and just throw it out. And then that way you're able to manage your stress, understand your stressors, and then that way you're better able to deal with life effectively. All right, thank you.
Thank you. And these are very important nuggets. There are things that we can't say we don't know, but we sort of push it to the back of our activity list. So it's good to hear that it has a strong impact. And so we need to take these things seriously. Exercise, sleep. We really do need to take this thing seriously. So thank you, for making us realize that we need to prioritize this. So my last question is around, you had spoken to the fact that it's not having a mental disease is not the end of the world, that it can be cured. So please, can you talk to us about cures for mental health problems? What do I do if I'm worried about my mental health? What are the cures out there? What can we do about it if it already exists?
Okay, so if thank you for that, Anne. If it already exists, now there are experts that are available to provide the best of help. That's what we do at Grey Insight. We provide the best of care for you to be able to understand what you're going through. Now, one of the things that affects people and often makes it difficult for them to get help is because we don't even want to acknowledge that there is a problem. And the moment you don't want to acknowledge there is a problem, then you're losing out. you're really losing out on a big deal. And so it's important that, first of all, acknowledge the fact that something is wrong. And when you come, we help you to begin to see what is wrong. And then we're able to see areas where we can help you to now create a balance. Now, if your mental health has been jeopardized, now there are also experts who would help you to be able to get medications and treatments and other things like that. That's one thing that people run away from. Also, I don't want to be on medication for life. They say, and most times I tell my clients, I say, all right, imagine a world where there are no medications. There's no help. Then it's even going to be worse. So even when you have the problem, you have the condition, there are helps that you can get. You can speak with a professional that will be able to help you to be able to get help. People most times don't even need to live on medication. Sometimes you don't even have to go on medication for anything. When you just have what we call psychotherapy, a talk therapy, we talk, we give you a better insight, a better way of dealing with the problem, and then that way you are functioning, and then you go back on your feet. And with that strategy, it helps you effectively. So it's important that you speak with a professional who would help you to be able to balance things up. And if you now need more care than that, it can also be provided. The most important thing is taking charge of your health, doing the best that you can do, and then pushing forward effectively. Thank you, Anne.
Thank you so much. I wish I could go on because I'm totally enjoying this, but I can see that we have a few questions, and I promise that we take the questions. So I'll just go into the question and answer chat and take one or two of the questions. In fact, we'll try to take all of them. Let's see what we can do with that time. So the first question is, do I suggest that we remove even benign breast lumps? And this would be for Dr. Dorcas. You had said that you could have benign breast lumps or you could have malignant ones.
Yes,
I'm a good
please.
student, I remember. So do we need to take out even the benign ones, please?
Okay, so that will be based on the diagnosis that comes out or the result of your mammogram. So that would be on the discretion by the surgeon or the medic that sees you. Most people would say, let's take it out so that it doesn't even outgrow or develop into cancerous cells. I've seen young ones, we call one fibrinogen. It's normally taken from the breast of teenagers and younger. So ideally, most doctors would prefer taking it out so that they save you the mental trauma with the fact that it's still there. What if it develops infectious and all that? And sometimes they'll even give you medication if it is infection aligned or related. They can give you a medication to take care of it. So depending on what comes out of the investigations.
Thank you. I think that's very important because some people would be confused, as to how to go about this. And so my second question is around a very interesting topic to me. Is there a difference in the BMI for Africans? As you know that we have high caloric food here in Africa. So can we compare our BMIs to, the Europeans and all? What's your take on that?
So with that, you see, Africans, we don't have most of these things that are done by us. So normally what we do is we adapt it and use it to check. Ideally, the BMI for Africans should be between 18.5 to 24.9. That is for the normal weight. If you are going above that, if your body mass index is above that, then you are getting to the overweight and the obese state. So we have adapted. We don't have one that's we constructed or we did it ourselves, but we adapt and then we use it to suit us. So ideally, normal BMI should be between 18.5 to 24.9. If you're within that range, you're good to go.
Okay, thank you. I think we have another question yet for you, Dr. Dorcas. And this is, well, first thanking you for the session and asking what we can do to avoid cancer, in particular around the foods and the diets. So the question is, are there foods or diets that actually trigger cancer?
I remember when I used to work, when I have my patient, people living with cancer or going through their chemotherapy, and they'll come, Madam, they say we shouldn't eat sugary food, we shouldn't eat this, we shouldn't eat that. And then the question a dietitian will say, if you don't eat those things, you need those elements to help you live and get the strength to do the chemo or to do the treatment that you are doing. As I said, there is no evidence that says you eat this food and it predisposes you to cancer. However, I've said that obesity, alcohol intake, smoking predisposes you to cancer. When you're talking about obesity, it comes with food. So are you eating a lot of fats? Are you eating a lot of oil? Are you taking in a lot of carbonated drinks, sugary things? All this makes you become big, or you increase in weight, and hence you are being predisposed to this condition. So we should check it from that angle. Anything, I can take in a lot of fat and oil, I might not bloat, or I might not gain a lot of weight. Somebody will take a lot of carbo and it will do the same thing. It will let the person bloat and all that. So you should be aware of yourself. Know what works for you, what is not so good for you. Then you cut on that. So with that question, I will answer it based on the fact that obesity or overweight predisposes you to cancer. So know how you put your weight together so that you don't get on angle. But now there is no evidence that shows that you don't eat this, you don't eat that, you don't take in this. Thank you.
Thank you so much. That's very clear. I think I'll give you a bit of a break and move over to Dr. Akintoyeshe. So,
Okay.
Dr. Akintoyeshe, the next question is for you, and it is, what can one do if one no longer feels motivated to walk and tends to cry often?
Mm. All right, so we're looking at someone who peradventure might be experiencing what we call a burnout. Okay, because with that, it comes with lack of motivation. It also comes with the fact that the individual might feel unmotivated to work, and you just not being able to function. So if you feel it that way, honestly, it's the best time to take a break. Okay, take a break, talk with someone. It's important because sometimes the triggers are on the workplace, and then adding more pressure to it also will just wear you down. So take a break, and then we can now talk and see how best to help, especially also if there might also be some other factors aside work that might be distressing to you, because sometimes it's not just the work. This individual is a daughter, a mother, a wife, or something. So the pressure is coming from left, right, and back, and then you might need to just talk with someone. But taking a break would be appropriate at this point in time, and then talking with a professional to help you understand what exactly is going through and then how to navigate this period is important.
Thank you. And it's important to point that out because, we're so used to just roaming from target to target that simple things like take a break, doesn't occur to us. Before I move on to the next question, I'd just like to point out to everyone who's on this webinar the fact that we are now in the question and answer session. So please, if you have any questions, you can put them in the Q&A chat. It's very important. Let's take advantage of the fact that, we have these doctors, very knowledgeable. I guess once we leave here, we'd have to pay for any questions we want to ask them. So let's use this opportunity to ask all the questions that we need to. Thank you. So I'd go on to the next question. And this is speaking about, the reality of a lot of us now. It says, with the present economic situation, how do we balance life issues and bills? The salary is not matching up with the bills. So you're here saying, the truth is, people that are trying to do these calculations, the cyber problems are real problems. How do we balance this situation?
The truth is, the calculation is not calculating again. They add up. Really, it's not adding up, and that is our reality. But you know what I tell people is this: there's something we call the ideal and the real self. The ideal situation and the real situation. So the ideal is where you have money, you have all of this expectation. The real is the money is not there. What you bought yesterday is not what you're going to buy today. See, one of the things that you must do, first of all, is adjust your mental set. Adjust your mental set. What needs to go? What can I add up? What do I change? That needs to be paramount, because if you do not get that, you will begin to have problems all the time, especially emotionally. We feel overwhelmed. Buying bag of rice for 60,000, it's overwhelming, in this kind of economy. But the truth is that has become a reality. So if I can't buy a full bag, can I buy a half bag? Okay, there are certain things that you may have to let go. Let me just give you a quick one now. I got my children. I said, but that was even early in the year, around April, May. I said, oh, let's take Holt and sardine, and then let's do toast bread. And the guy went out to buy sardine, and he brought one for me for 700 naira. And I was like, excuse me, but you know what I told them? I said, excuse me, you are taking the Last Supper. You know the time that Jesus took with his disciple. Oh yes, we threw it into humor. Find humor in this time. You can't overwhelm yourself with a situation that you cannot control. The moment the control does not lie with you, please let it go. Find a way to cope. Adaptability becomes the key. Flexibility becomes our watchword. Become more flexible. What can I do? How can I navigate this? The things that you can do. Adjust your thinking, adjust your mind. There is no negativity. Don't see yourself as there is a problem with you. There is no problem. Everyone is going through this. So it's not just your singular problem. So don't see it as life is not fair to you. Don't see it as negative thinking won't help you at this point in time. So be positive, find humor, find joy around. Do the ones that you can do. And please be happy with yourself. Thank you.
Thank you so much. We this session is so important. It's so important to deal with your reality in a way that you realize that prioritizing your mental health is more important than everything else. So where you have to cut down just to stay sane, you really need to do that. I really love those nuggets of advice. Thank you so much, Dr. Akintoye. And we'll just go quickly to our more breast cancer related questions. So I'll go back to Dr. Dorcas. We've given you a long break now, so you should be ready for our questions. Okay, so some of the questions we have is are how can we practically do a breast cancer test ourselves? And are there solutions for breast cancer aside from mastectomy? Because not everybody wants to cut themselves, right? So please, if you can take those two questions.
Okay, so where you can do a test to check maybe your risk of developing breast cancer. You can go to the hospital, you speak to your medic or your physician that you would want to do a blood test. It's called tumor marker test. So you want to have a tumor marker test. It has its range. When you are above, then you know that you are likely to have some of this conditions. So you speak to your physician concerning that, and he will do the right thing for you. He will she will do the right thing for you. Now, let's come to treatment of breast cancer. You see, mastectomy, when you're talking about treatment of breast cancer, it's like a whole from this, we are coming to this, from this, we are coming to that, and all that. And when I was talking about the diagnosis, I told you that it comes with stages. So depending on the stage you are in, even determine the kind of treatment that would be outlined for you. Mastectomy is just one of the ways, one of the treatment models for breast cancer. We have chemotherapy. It's also one of the treatments. We have radiotherapy. We have medication where you take tablets, chemo tablets, tamoxifen and others. So we have treatment protocol. However, most patients go through all this treatment depending on the stage that you come. So some people will do the chemo first, then continue with the mastectomy, do radiotherapy, and then they continue with the medication. It should be noted that most of the patients that report come at the latter stage in our part of the world, Africans. We always wait when it's getting out of hand. That's when we come. So by the time the individual comes, it's already getting out of hand. So the medics now need to come together to do all that they can to save this individual. In Ghana here, I know some hospitals, when the moment they find out it's breast cancer, I know one female, the first thing she will do is mastectomy. take it out for you, because what she intends to do is she's taking that part of the body from the rest of the body so that it can't metastatize. That's what we call like it's being transferred from one organ to the other. So you say there is a mix. So to prevent that, she quickly do that. And at the end of the day, you feel comfortable so that you can go through the rest of the treatment. However, when you come again, it's dialogue. You talk with your doctor. I wouldn't prefer it. What is the alternative? So you will weigh the one that best fit for you. You can go in for it. So it's not compulsory. It's what is best for you and what you agree to. Thank you.
Thank you for providing that clarity, because I guess people are a bit worried about, that being the only option. So at least we're glad to hear, and especially from what you said, depending on the stage. So that whole idea of early detection is very important if you don't want to go, to the extreme in treatments. So thank you for that. For a second, I'll just go back quickly to Dr. Akintoye. I know we are 1 minute past time, so I'll just take the last two questions real quick. First, our participant is thanking you for the session, but says that this is very pertinent to them. And it's how do we prevent our kids from actually having mental breakdown issues, especially as working mothers? Lots of mothers are not at home all the time, to manage it. How do they manage that?
Okay, so thank you so much for that question. Parenting becomes a very golden thing at this point in time. Bonding with them also becomes the key. Bonding with them. Communication is important. Earlier, I was saying sometimes people talk and we don't listen. So when they talk, you must be able to hear. It's called active listening. You must be able to hear what is it that they are saying to you. So it's about bonding. It's about communication. It's about being involved in their lives. So they are able to help them also to be able to come into a place of their own. And now what we do as parents a lot of times, if we don't allow those children to explore their world, make their own mistake, allow them to explore their world, allow them to make their own mistake, let them find their footing. The moment they're able to do that, they will begin to realize that life is not just bread and butter. Now we have quite a lot of children or kids now, or adolescents breaking down with mental health issues. And because we found out that a lot of them are developing physically and intellectually, but they are not developing emotionally. And emotional development is very important. So it's about exposing them to the real intricacies of life, building resilience in them, the ability to be able to bounce back even when now children fail in school, they say promote them, and they know how to allow them to go through the rigors of understanding what failure is all about. Now building their self-esteem, the self-value. Self-esteem is important. Build a self-value in them that would help them to be able to see themselves for who they are, value themselves. And these are things that we get in the process of parenting. So it's effective that if we're able to do all of these things, then we'll be able to have children who are emotionally stable. And please, let's not forget that when you have a child who is emotionally stable, then you have an adult who is emotionally stable. But when you have a child who is not emotionally stable, then you are looking at an adult who will not be emotionally stable in the future. Thank you.
I agree completely. Thank you so much. That is very important for us to know. Even when we're tired, we need to make those emotional connections. We just have to make that happen. Thank you. And we have another one, and this is around toxic work environments that can affect people's mental health. So someone is asking about a situation where, even going on leave is difficult to do. And so there's a high burnout and people get bullied and all. How do people manage in this sort of situations? Because it's not everybody is fortunate enough to be in the ideal work environment. How do people manage with this sort of things?
Now, the thing is, I know that most organizations now have HRs that they can, in a way, report to, so that the line of communication should be open between the workers and the HR, who will be able to facilitate things like that. I once had a boss who our own leadership style borders on being wicked. Unfortunately, there was nobody to save us. We just had to develop thick skin and we have to navigate. But again, for some people, they were not able to successfully navigate the period. Now, please speak with somebody. If there's nobody to speak with and you cannot leave the organization because of the economy, then find a way to adjust. That's what I tell people. Find a way. See, we have options, okay? Now, sometimes the organization values, you have people at the top who would come in, who will step in and be able to help you deal with the situation. That is on one side. Trainings and other things like that can be organized through the HR without directly letting anybody know that this is the problem. And so you just bring a training on bully, and the person is there, is listening, and he understands that this is talking to me directly. No, HR can do something like that. Or if you have suggestion box, you could do that. Or if you as an individual find out that, oh, nothing is being done, but I don't want to lose my job. Now look at this. I have an envelope here. The most important thing, again, is not the envelope, it's the content. So I discard the envelope. Honestly, the approach I used then was that I discarded the envelope, which was my boss. Now I'm not discarding that in person, but in my mind. And that's where it starts from. See, your perception about the person, your perception about the situation comes on in your mind. So in my mind, oh, this is not relevant to the real issue. What do I need to do? Am I getting my job done? Am I doing what I need to do? And then you focus on doing the job and walking through it. And then that way you will find. So what you say to yourself is also very important. And when you leave the workplace, please find a safe zone. Find a comfort zone that can help you. What I do a lot of times, I go home and I distress. I talk with my children. Yes, I am the queen in my palace. And then before we now come to the office again the next day to take on whatever it is. But you just have to find a way to adapt, adjust, and cope with the situation. Thank you.
Thank you. And I love that, we don't always have a choice. So you have to find some coping mechanisms. And I like the whole envelope. Pack it aside and focus on what you want to, just to balance your mental health. I really appreciate, all the advice you've given, Dr. Akintoyeshi. So I'll just go to the last question because we're well behind time now, and it's for Dr. Dorcas. And this is a question around breast cancer. Are there any major exposures for breast cancer to the average working class lady?
Major exposures. I'm not really getting the question, but if I will take it from different major exposures, is he talking about not being in an environment because radiation exposes us to breast cancer? So that was why when I was speaking about mammogram, I thought that it has to be regulated. So if you are working in an environment where you are always exposed to radiation, then at the end of the day, you stand at a higher risk of developing breast cancer. And there are some chemicals that at times you are exposed to, maybe in our pomade, the bleaching ones. It also exposes us to skin cancer and all that. So working like a normal classroom. And also the things, that's some of the things that risk factors, we don't know. It's not a fact, but these are some of the things research is beginning to get into. 10 stuff that has been kept there for long. We don't check dates, we use them. There is also some exposure to cancer cells.
And would stress at the workplace also lead to that? Could stress at, okay, well, there's no way to tell at this point, right?
Yes, but stress. Let's come to stress. As Doc has said a lot of things concerning that. But when one is under stress, we have these new neurotransmitters in our brain, cortisol, adrenaline. The moment they are in higher excess, it releases sugar into the body. So at the end of the day, sugar being added to your normal production of sugar, what it means is you are going to be exposed to, you are going to be overweight. You are going to that likelihood of being obese. So it's all linked and come back to that fact that you give yourself away so that you become at risk for developing that. So stress at work in a way can also give you up for developing breast cancer.
Thank you
Yes.
so much. I know that there are
Mhm.
several questions, but we'll have to close now because we honestly have to keep to time. I really, really want to appreciate you, Dr. Akintoye, Dr. Ntiamo. You've given us so much to go and ponder on, very important facts. We really, really appreciate you. And to all our participants, thank you so much for taking time out on a work day to come to this session. So I just say thank you for joining this edition of Leading Conversations with FBN Quest, which is focused on breast cancer and mental awareness. We hope you found it informative and look forward to engaging with you further to take advantages of the opportunities that we shared today. We have several more insightful and relevant topics planned in the coming weeks and months. Please follow us on our social media platforms, X, Facebook, Instagram, and LinkedIn, using at FBN Quest, which is our handle, so you don't miss out. If you have any immediate questions or any support that you may require, please send an email to webinars@fbnquest.com. That is webinars@fbnquest.com, and we will be happy to guide you towards your goals. We wish you a safe and productive day. Thank you to our dear speakers. Thank you to our dear participants. Thank you all. And take good care.
Thank you, Anne.
Thank you for having us.
Thank you, Anne, for having us.
Thank you so much.